Right now, people in the United States owe at least $220 billion in medical debt. 14 million people owe more than $1,000. Now, cancer patients and their families can get financially crushed by the cost of their treatment. It's a story first seen in the Wall Street Journal. One mother shared her ordeal with ABC News as she struggled to pay the bills for her son's care. Here's ABC's Laura Spencer with that story.
Erica Olensky of Texas says cancer treatment for her 5-year-old child, August, has not only been emotionally draining, but also financially.
You can go into the world making all of the best decisions you can. And a diagnosis like this can swoop in and it will affect all of those structures and sense of stability in ways that are unimaginable.
Erica, who has alopecia, says August was diagnosed with brain cancer at 5 months old and is still fighting the disease. She says it's not only the medical bills that have added up, but also other expenses related to cancer treatment that have caused her to recently file for bankruptcy.
Impact on earning potential in combination with just like housing, temporary housing, food, all of those other expenses that come with long-term hospital stays.
Cancer survivors are 2.7 times more likely to declare bankruptcy as compared to someone without a known cancer history.
The Wall Street Journal recently reporting on the cost of cancer, or as it's called in the medical field, financial toxicity. The Journal finding that many new cancer drugs cost more than $200,000 per year before insurance. And those costs vary highly for those with insurance.
We are actually seeing some cancer patients live longer with the disease, thanks in part to some of these really expensive drugs. And so the downside to that is sort of these costs.
But the American Cancer Society says there are some things patients can do to lessen the financial burden.
The concepts of having three strategies are really important. The first is to understand your coverage, get to the bottom of what your health insurance will pay for and what it won't. The second is to seek financial assistance. Don't wait, ask for it. And thirdly, work with your oncology team. Tell them what you are experiencing because there may be opportunities. For example, a shift to generics is sometimes a perfectly reasonable approach to undertake.
And according to numbers from the census, if they had to pay for medical care today, 19% of households could not do it.